Hope your day is going well. This is CNA Monthly Training for February 2024. It's on active treatment or how to hang out therapeutically. Active treatment includes specialized and specific training, but it also includes informal instructions, such as client-staff interaction, that engages and reinforces learning. It's a requirement that individuals are engaged in meaningful activities throughout their waking day. Active treatment is conducted formally, as in classes and therapy, and informally as part of the day-in, day-out routine in their home and throughout their schedule, wherever they are. Maintaining skills. In many cases, it's easier for staff to do for our individuals rather than expect them to do for themselves. But if our individuals have skills, they must use them to keep them. We can increase dependence on staff by our individuals if we don't expect them to do for themselves. Expecting individuals to do as much as they can is a requirement, and more importantly, it's the right way to treat our folks. Being client-centered means everything is centered around the individual's needs rather than the needs of staff. Staff have a responsibility to interact with our individuals in a positive, nurturing fashion, encouraging them with meaningful conversation, leisure time activities, positive interactions, personal grooming, etc. Interaction should be client-centered. Important qualities of active treatment. Staff must be physically close to individuals being served. Staff attention should be directed towards individuals being served. Pegs and pegboards, Connect 4, TV, or any passive activity that is not client choice or is not a vehicle for staff interaction will not result in favorable outcomes, and it is not considered active treatment. Choices are as important to our individuals as they are to us. Making choices is a right for our individuals. Giving people choices show them that we respect them and that their opinions matter. People will be happier if they can control some aspect of their life, and the choices we make determine who we are. What choices do you offer? Things to consider with choices. You know this individual likes ketchup on all of his food, so you prepare his food like that without asking, actually depriving him of an opportunity to select his food and how it should be served. This individual likes wearing short-sleeve t-shirts, so it really doesn't matter which one he wears. Actually, it probably does really matter to the individual which t-shirt he wears today. Think about the choices you make each day regarding your life. Now, some things are not optional, so they're probably best not offered as choices. For example, it's best not to say, "Are you ready to go to class?" In this case, it'd probably be better to say, "It's time to go to class." Using a multisensory approach in training is always helpful. A multisensory approach is a way of capturing an individual's attention by utilizing different sensory approaches. For example, in smell, utilizing a pleasant or slightly unpleasant smell to accompany training. In taste, utilizing tastes, especially in training simple food or drink preparation. Seeing, utilizing colors or lights to emphasize training. And to feel, that is to utilize touch to accompany training, especially soft texture. Group activities. While one-on-one attention should be given to individuals when necessary and possible, group activities are an efficient, effective way of engaging several individuals at one time, but it takes a lot of planning and lots of energy to maintain a group's attention. Small groups are better than large groups. 2 groups of 4 individuals to 1 staff are better than 1 group of 8 individuals to 2 staff. You want to minimize distraction during group activities and definitely be aware of personality conflicts in designing who's in your groups. Themes are topics for discussion. Some unifying theme is often needed during interaction. These themes can include current events, the weather, sports, likes and dislikes, food or menu items, holidays, family members, music, etc. These topics become the source of discussion for interaction and should reflect the individual preferences of those involved, including staff. Interaction during a group discussion or activity. You need to select a functional, age-appropriate theme or activity. You need to make an activity plan, assemble materials, set up the environment, think about your group, and list support so that the activity can be conducted without significant interruption. Arrange the environment so that all individuals are easily accessible and can participate. Let's take a moment to think about themes. Consider possible themes for a group discussion that are age appropriate and of interest to your individuals. For example, baseball. List any materials that you might need for each theme. For example, passing around a baseball. Consider activities that might reinforce each theme. For example, tossing a baseball and using a baseball glove to catch it. Activities used to meet individuals' goals are called vehicles. If someone was working on hand-eye coordination goal, folding towels is the activity that has been chosen as a vehicle. It doesn't mean you're going to get all the towels folded, however. The completion of the task or how well it's completed is secondary to the experience or practice of performing the task. Now we're going to think about activities that can serve as vehicles to meet goals. For example, helping an individual to learn self-help skills, an activity or vehicle to improve on that goal could be using a microwave to warm a can of soup. The reward that could be used for completing that activity would be to eat the soup. And a possible obstacle that you might encounter: does the individual have dietary restrictions, or do they need real close supervision to prevent them from being burned? Key teaching principles. During group activities, the staff person becomes the teacher. The teacher should not do for the individuals but allow them to do as much as possible for themselves. The most important goal is for individuals to decrease their dependence on others. And the activity is a vehicle to help participants reach their individual goals. For individuals to benefit most from their training, they need to be motivated. To motivate individuals, you need to select meaningful and stimulating activities. You need to use a multisensory approach. You need to incorporate choice whenever possible. You need to use an enthusiastic tone of voice. Be fast-paced. If clients start to lose interest, gain their attention and direct them back to the activity. Provide lots of individual attention and provide rewards upon completion or progress. Interaction tips. Staff interacting with individuals in a structured fashion should be occurring routinely. Interaction needs to be a two-way street. Responsiveness and interaction by the individual should be encouraged by the staff person. Interaction should reflect an age-appropriate relationship. If the individual being served is older than the staff, then the staff person would refer to the individual as Mr. or Miss. If the staff person and the individual are about the same age, then first names will suffice. There are four main teaching areas: functional skills, communication skills, social skills, and increasing the ability to think and understand. Functional skills are essential skills such as opening containers, washing hands, brushing teeth, dressing or grooming, and more besides. A person who cannot do a functional skill will have to depend on someone else to do it for them. Communication skills include the two types of communication. There's receptive communication, which is the ability to understand what someone is communicating to you. There's expressive communication. That's the ability to communicate your needs, wants, feelings, and ideas to others. Receptive communication includes the names of people, the names of objects, action words, words for feeling, words for simple instruction, and much more. Expressive communication. We know that many undesirable behaviors are a result of individuals not being able to communicate effectively. Expressive communication is much more than just verbal communication. It can be eye gaze, it can be vocalizing, reaching, touching, pointing, or gesturing, functional signs, picture communication, or verbal words. Social skills are skills that are learned to get along better with others. Some skills include taking turns, engaging in appropriate interaction, tolerating the behavior of others without becoming agitated, sharing, and more. Sometimes just being able to sit next to someone is something that can be taught in a group activity. Increasing the ability to think and understand means being able to understand cause and effect. For example, an individual understands that if I assist with mealtime routine, then I will get to eat a little bit quicker. Being able to understand sequencing. For example, I know that after lunch I go to the gym for physical exercise. There are key teaching strategies. First of all, you need to get the individual's attention. You need to use a multisensory approach. You need to use very simple language, emphasize and repeat the most important words, and you need to repeat the activity many times. Prompts are reminders provided by staff to get individuals to initiate learning activities. They can be minimal or they can be intrusive. Examples can be a slight gesture all the way up to manipulation of the individual to get them to start a task. There are different levels of prompting. Gestures are the mildest level of prompting, that is pointing or gesturing toward an object or an action. Verbal prompts use verbal direction, usually very effective but hard to get beyond this to independence. Physical prompts can be a slight touch, getting an individual to initiate an action, and then all the way up to manipulation, the most intrusive, hands over hand, physically guiding someone through an action or a response. For effective use of prompts, you need to follow the prompting sequences using the least intrusive. You need to avoid over-prompting. If someone requires physical prompts, give the least amount of support necessary. Fade prompts as quickly as possible. If someone draws back from a physical prompt or manipulation, do not force them to do what you are asking them to do. Partial participation. Due to physical or mental challenges, some individuals cannot do all the steps involved in a task. Some steps may have to be done by staff as assistants. Partial participation recognizes that some individuals may need help, but they can do the other steps with minimal assistance, if any. After the task is taught or while the task is being taught, you need to reinforce progress in learning. You need to utilize an enthusiastic tone of voice. You need to provide immediate reinforcement or reward. You need to use specific praise. You need to reinforce progress. You combine reinforcers with specific verbal praise, and you remember and use partial participation. For serious inappropriate behaviors, follow the individual's behavioral guidelines or strategies and document the incident on a behavior report. But remember, it's always important to praise an individual that's participating and improving in their training. Praising them in front of others is also very effective. Some individuals have very specific kinds of reinforcers or rewards, so it's important to know what the individual likes. But typically the most effective rewards are simply providing the individual special attention when they do well. Ignoring inappropriate behaviors can be effective managing difficult behaviors that are not dangerous or very disruptive. Ignoring minor behaviors can help individuals learn which behaviors will not receive attention and eventually stop them. Ignoring behaviors that are not physically or psychologically serious while providing lots of attention for appropriate, desirable behaviors will result in dramatic improvement in how a person acts. Redirecting behavior is a technique that involves changing the focus of the individual's attention from an undesirable behavior to a more positive one. It interrupts and redirects their challenging behavior and attempts to calm them down and avoid further conflict. This can be effective in making them less likely to continue the negative behavior. How to teach. First of all, you need to get the individual's attention. We need to use a multisensory approach. You want to use very simple language, emphasize and repeat the most important words. You need to repeat the activity many times, certainly encourage partial participation, and address individualized goals in every activity. Use the prompting sequence, giving the least amount of assistance required. You fade the prompts as quickly as possible. When teaching a new skill, demonstrate the steps first. Motivate the individuals to participate in the activity. Reinforce any progress in actions and behaviors that you want to happen again. To sum up, appropriate and meaningful staff interaction is a requirement of staff at CHDC. More importantly, this is the way people should be treated. If you need additional information or support about staff-client interactions, be sure and ask your supervisor to contact staff development or call us directly at extension 267. These are the references utilized in this presentation. Don't forget to print out the test and go ahead and complete that, and then get that to your supervisor so that it can be graded and then turned in to staff development. Thank you very much for your participation in this.